drill sergeant who's perhaps barking orders at you to do push-ups or jumping jacks or some other dreadful thing, and you just don't want to have to move your body to get benefits. So this is the fourth video of information on how you can help balance your blood sugar. And the fourth tip or topic is all about movement. I'm Janessa Finley with Fiercely Radiant Soul. I'm an energy psychologist, mindset specialist, and I also read blood labs for people with a functional approach so that we can address the symptoms that people are having and get them relief by addressing the whole body and being, not just picking a piece or part and masking a symptom, because the whole body works together. So if one thing is out of balance, something else is going to be out of balance too. Let's deal with it all. So over the course of the past several days, I have been talking to you guys about blood sugar, because blood sugar is one of those underlying components to many different ailments or dis-ease that people experience in their body. It's so valuable to get ahead of the curve and support your blood sugar simply by the food you eat or small little decisions that you make throughout the day. So let's get into this topic of movement. How much or how little movement does it take to influence your blood sugar? And do we need to be working in large quantities of movement, like 30 to 60 minutes a day, or small bursts of movement, like 5 minutes? What's the scoop? Researchers found that individuals who walked for 10 minutes after every meal reduced their blood sugar by 12% comparatively to people who walked once a day for 30 minutes. So obviously they were eating 3 meals a day. And when the time frames were split up in moving their body versus doing one chunk of activity, the reduction in the blood sugar was 12% more. That's incredible. So we're not talking about high intensity, high labored movement. Simply going for a 10-minute walk a multitude of times, and in fact, I would encourage the sweet spot for blood sugar to be 5 10-minute walks a day. But these small time frames of moving your body simply by walking is going to help you burn some of that sugar out of your blood and support your body and your overall wellness and health. Now, a lot of people's jobs don't truly support this. How many people have active jobs? In fact, if you're watching this now or on replay and you have an active job, I want to hear what it is, because I feel like the large majority of work for some reason involves sitting on our tushes all day long, and that doesn't set us up to get in a healthy amount of movement for our bodies. So we have to be intentional. But if you simply do a 10-minute walk before you start work, take your 15-minute break, go out for that 10-minute walk, lunch break, 10-minute walk, your second 15-minute break, 10-minute walk, and you walk for 10 minutes after work or in the evening, you can get into a rhythm and get into a flow, and it's really not so hard to get those in. Now, for people who have kids, even playing with your kids for 10 minutes, jumping on the trampoline, getting your heart rate up, your kids will love it, and you're going to benefit from it too. So there's a lot of ways that you can get that activity in, and it doesn't have to be a walk. It can be as simple as a walk. So work it into your lifestyle in the way that it fits for you. So also, if you have been watching this video or the all 4 videos that I've put up and you have learned something, I would love for you to also drop that in the comments and let me know what you have taken away from this little mini series on blood sugar. What did you learn about your body? What are you incorporating, changing, or doing to support your overall wellness? And if you find these videos to be valuable and you've learned something about your body, the way that it's connected, the way blood sugar leads to or doesn't lead to fatty liver, cholesterol issues, hormone imbalances, so much more. Inflammation, which does lead to potentially cancer, heart disease, right? Like there's a lot of things that blood sugar contributes to. If you'd like to look at the overall wellness approach of how your body works together, I would love to support and continue to teach and guide you in that endeavor. One of the ways that we can do that is by reading your blood labs. Speaking of blood labs, I did mean to tell you, I know I put it in the description, if you have your blood labs and you want to look at your glucose, what is the optimal range for your glucose to be between for the blood lab results? And optimally, we want to see that glucose, which is the short time frame. Now, your AC1 is going to be a longer time frame of your glucose. We're just going to talk about the short little snippet in time on a fasted blood draw. Truly, it does have to be fasted. And ideally, we want to see that between 85 and 95. And that will keep you in an optimal range. However, what it does after you eat can be really interesting, and without a blood sugar monitoring device, you really won't know that. So the fasted range is 85 to 95. And if you want to know more about your blood sugar and what it's doing, you can easily prick your finger, take it at home. It's pretty fascinating to watch those numbers fluctuate based upon what you eat. Some foods that you think might not have much of a blood sugar response, you're going to have more of a response than you think. And then seeing the immediate results of going out for those walks or getting your body moving and taking it again is really insightful. So, if you want to know more about beyond the blood labs of just the glucose and how your body works together, if you're not getting the relief of symptoms that you have for some of those hormone issues, thyroid issues, joint pain, cholesterol panels, all sorts of different things that we dive deep into, I would love to be your guide and teacher. You can shoot me a private message and we will get a 30-minute discovery call scheduled to see what you're dealing with and how we can jump into this healing journey or this holistic approach to treating your whole body as one unit, the one unit that it is, to balance it and get you the relief and health that you want. So I look forward to hearing from you. Thank you for joining me in this mini series. I hope that you're incorporating some of these tips in to your daily life and that you are feeling the wellness and benefits of doing so. Movement is always a topic for so many facets of wellness. So rest assured, if you do make the commitment to get up and move your body a few times during the day, you're going to have a lot more going on for you than just your blood sugar. You're going to get those endorphins and so many other health benefits from it as well. So be well and enjoy your evening.